everyone. My name is Christina Baik. I'm an associate professor of medicine at University of Washington and Fred Hutchinson Cancer Center in Seattle. Today, I'll be discussing about non-small cell lung cancer with RET fusion. And I organized a talk based on the conversations I've had with my own patients and some of the questions that I have been asked in the past. So hopefully this will be helpful for you as well. Now, this is an old slide, but I think it's a helpful diagram to start with. So this shows that lung cancer is not one disease. As you know, lung cancer is made up primarily of small cell and non-small cell lung cancer types. And within non-small cell, there are even more subtypes based on the cells that make up that cancer. And the most common type is called an adenocarcinoma. And these are, again, made up of cancers of different genetic makeup. And the reason this is important is because these cancers have a particular genetic abnormality that makes that cancer grow. And treatments are usually different for the different genetic abnormalities. So even though we say lung cancer, every person may be different and may be getting different treatments. As I mentioned, for this particular talk, I'm going to focus on the RET fusion positive lung cancers. And then for the rest of the talk, I'll just refer them as RET positive lung cancer. So as you can see, pointed at by the orange arrow, that RET positive lung cancer is not very common. It's estimated to be present in about 2% of patients with lung adenocarcinoma. Now, even though this is an uncommon type of lung cancer, because lung cancer is so common, it can still affect many patients. So the estimates are that several thousands of patients were diagnosed with RET positive lung cancer in 2021 alone. So who are the patients with RET positive lung cancer? First, patients tend to be younger, but you can see this cancer at any age. Now, when we look at clinical trials of RET targeted therapies, the average age was around 60, but there were patients in their 20s all the way to 80s. So it really can happen at any age. Patients do tend to have limited or no smoking history. So again, in clinical trials, about 60 to 70% of patients did not have a smoking history. But patients who do have smoking history can still have this type of lung cancer.